Hey everyone, welcome back to my YouTube channel. My name's Sarah Lavonne. I am so glad you're here. We are back for part 2, all about twins. I am gonna reference some things that I most definitely explained and I hope became very simple to understand for you in part 1. So if you haven't seen part 1, I'm gonna suggest you head on over to part 1 and watch that video so you know what I'm talking about, because I'm gonna be using terminology like di-di, mono-di, mono-di, or di-di, mono-di, mono-mono, all of the variations of what that means, and you need to know what that means in order to understand this video. So today I'm going to talk to you twin multiples families, and I'm gonna tell you what to expect for your labor and birth. What is different, how to prepare mentally, sort of like what's the chance of a C-section versus a vaginal delivery? When will you deliver? What are your options in labor? And any other tips I have for you today. So make sure you subscribe down below, share it with any of your twin mamas, comment with the type of twin you have, send me your questions, and then let's get going. I have been getting questions on probably all of my videos here on this channel from you twin mamas, because I think one of the fears is, can I do this? Does this apply to me if I have twins or multiples? I'm gonna specifically speak to twins today because that is the most common. If you have triplets, just ask your provider, and always, that's my disclaimer always, is ask your provider, what's an option to me? What's my situation? What recommendations do you have for me? Because as a caveat, a twin pregnancy is considered a high-risk pregnancy, and I am coming back in part 3 to discuss what are the actual risks. Why are you considered high risk when I think it's easy to think, well, I just have 2 babies. I have 2 healthy pregnancies. What's the difference? And I'm gonna explain that for you in part 3. So make sure you subscribe down below. We'll come back for that. But today I wanna talk about the fun stuff, which is what to expect for your labor and birth for your twin pregnancies. Now, I am pulling data from ACOG, the American College of Obstetrics and Gynecology, and the maternal fetal medicine doctors, which are your high-risk doctors, to give you their recommendations. The first recommendation / the first consideration for your labor and birth, I keep winging around my eggs here, and I'm gonna set them down because that's a lot. So the first recommendation is that you are going to expect to deliver by week 38 of your pregnancy. When you are given a due date, that is your 40-week due date. For a singleton pregnancy, 1 baby, 40 weeks is your due date. But for your twin pregnancy, you're not gonna hit 40 weeks. I've never seen anyone hit that's not true. I've seen one person hit 40 weeks because they refused to come in for an induction. Otherwise, it is pretty rare to make it to 38 weeks because everything is so distended, your uterus sort of runs out of space, and twins typically develop faster than 1 baby does inside, which sets them up for life success when they deliver earlier because we expect that, okay? So for a die pregnancy, the cutoff is 38 weeks. You're gonna be recommended to be induced at 38 weeks, if not before that, by your OBGYN, and you probably are being covered by an OBGYN instead of a midwife. There may be some midwives that take twins, but in general, because it's a high-risk pregnancy, you're gonna be pushed onto an OBGYN team. If you have a mono-die pregnancy, and go to part 1 to know what that means, the recommendation now becomes 36 weeks. So for die, which is the most common, 38 weeks, sometimes before. Mono-die is 36 weeks, and then mono, 1 placenta, one sac, they're together, they're intermushed, they're hugging the whole time. You're looking at 32 to 34 weeks. And those ones we are gonna talk about particularly in part 1. They're the least common that they're in 1 sac, but they're also the highest risk, which is why they're gonna be recommended to deliver earlier. The biggest question that I get is a C-section versus a vaginal birth. Can I give birth vaginally with twins? Okay, the answer to this is yes, you absolutely can. And actually, surprisingly, most of the twins that I've delivered were vaginal births, which is a little bit wild when you think about it, because I think there is this stereotype that you have to have a C-section. But here's the caveat, that we're looking at twin A. So whenever you get pregnant, your babies are gonna be labeled as twin A or twin B, and then at birth, everything is twin AB. So you're even like adult twins, a lot of times I'll talk to people, yeah, I'm twin A. Like they'll know if they were twin A or twin B. Twin A is the presenting baby. So So the one that is gonna be like, gonna naturally come out first, the other one is gonna be smushed up here somewhere, right? But either way, this baby's head is coming on out. It's the one on the exit. So this is gonna be twin A, this would be twin B. Now, in 80% of cases where baby A is head down, or what we call vertex, they'll deliver vaginally, okay? Now, that is for a di-di pregnancy or a mono-di pregnancy. For a mono-mono pregnancy, one sac, one placenta, they are always going to be a C-section. So if you found out that they are in the same thing, you're looking at a C-section, that is the safest option. It is not safe to labor with those two babies. And I'll talk about that in part 2, so make sure you stay tuned. But if twin A is head down, yes, it is possible to deliver vaginally for mono-di, mono-di, and di-di pregnancies. Okay, again, this is why you have to watch part A. You're like, all this di-mono talk. You'll go back to part 1 and learn about that, and then it'll all make sense to you, okay? Then let's say twin A is vertex, head down, twin B is transverse. In this case, that's exactly what you're seeing here. Or twin B is actually breech, okay? If they're like this, and it would probably be looking somewhat like this, in the abdomen or in the uterus, okay? If twin A delivers vaginally, it doesn't really matter what twin B is. But the risk is that breech vaginal birth, and I have 2 videos on breech, so you can check those out. Breech vaginal birth is a higher risk birth. You want a provider who feels comfortable delivering breech. And sometimes after twin A will come out, twin B actually comes out breech, or they actually reach inside and flip the baby, which is why my recommendation is going to be for an epidural. We'll get to that in a second, okay? You can do whatever you want. But in these cases, I am going to actually have a conversation about there might be benefit for an epidural in that case, okay? So can you deliver vaginally? Yes, but twin A has to be vertex. If twin A is not head down, you're probably looking at a C-section. There are very few providers that will deliver 2 breech babies vaginally for a twin case. The next question I get is, can I have a VBAC? What if my first baby was a C-section and then my second pregnancy was twins? Okay, that actually happens, and let me know if it did in the comment box for you. If twin A is vertex, head down, yes, it is possible, okay? But the same risks of a VBAC exist for you. So go to my VBAC videos. All of that applies for a VBAC. Now, the other case is that one of the risks of a uterine rupture, which goes along with VBAC, is over distension of the uterus. You imagine the uterus with 2 babies is a lot more stretched out than a uterus with 1 baby. So there may be quoted to you an increased risk of uterine rupture. You can work that out with your provider, but yes, it is possible to deliver vaginally after having a C-section with twins, so long as twin A, first one, is head down. So let's talk through what to expect for your labor and birth. First of all, expect to go into labor earlier, so you're gonna have your stuff ready by 32 weeks. Now, again, this is all gonna depend on what type of twins you have. I'm gonna talk about the mono-di, or di-di pregnancies here, okay? Because those are gonna be the least complicated. I'll talk about mono-mono in a second, but right now I'm talking about the first types of twins. Expect to go into labor a little earlier, have your stuff ready, okay? Now, when you go into labor, as long as you know that the twin A has been head down, anticipate a vaginal birth. Obviously, you're talking to your provider, you're working with a provider that feels comfortable with that, but in general, you can still labor at home. They'll give you some criteria for that. You'll come in, you'll labor like any normal laboring person with 1 baby, okay? Labor is virtually the same. Now, monitoring is different. So usually when you go into labor, and you learn this in my labor prep class and medical interventions class, is that they'll put monitors on your belly looking at your contractions and the heart rate of baby. Obviously, there's more than 1 baby, and so we'll have 2 monitors for the baby, and you can hear 2 different heartbeats on the monitor, which is kind of fun. They're gonna be watching for signs and symptoms that baby is getting enough oxygen or there are concerns. And that just really from a nursing perspective, we're watching now 2 babies instead of 1, and we have to make decisions based on what's happening there, okay? So expect extra monitors on your belly. Then the other huge consideration and huge differences, typically I'm speaking United States, and this may be different at your facility, but in general, twins deliver in the operating room. This is a shocker for people, okay? Versus 1 baby, you labor and deliver in a labor and delivery room that looks more like a hospital room or like a bedroom. An operating room looks very different. There's surgical equipment everywhere. It's really bright. It's cold. And the reason for that is that because once you deliver twin A, and this really is, you labor like normal, you get to 10 centimeters, all of my videos apply. Okay. And sort of when you're looking and watching the information from a childbirth class or from my videos, you're imagining that all of it applies, and I'm giving you all the caveats here. Okay. You labor, your cervix changes, you get to 10 centimeters, you get to complete 10 centimeters. They'll move you to the operating room. And then you push in the operating room like you're giving birth vaginally, like everything the same, right? There will be more people in the OR. If your baby is premature, there may be NICU teams there. Lots of people expect that. It may not be the most zen of all birth experiences, okay? It feels a lot more medicalized. And that is because once baby A comes out, they can go skin to skin as long as everything looks good. Same. You're having all these conversations in advance with your doctor. If they're premature, they may go to the baby warmer in the room. The NICU team will take a look at them and get them to you as soon as possible or transfer them, etc. But then guess what? You're not done because you had baby A and woohoo, yay. But you got to do it again. Now, does that mean you go through the entire labor again? You're having to push for 3 hours? No. Okay. Most of the time, depends on the presentation of baby B. Let's say they're both head down. Then the doctor may reach inside of you, which is why, again, I am going to make a recommendation for a epidural, and that will come together in a second. But then baby settles back down. Sometimes the cervix does kind of come back a little bit. So you have to labor a little bit more to get baby engaged and then get back to 10 and push out. That's where I want to know the time frame between baby A and baby B in the comment box down below. Guys, go look at this. This is always so fascinating to me. Most of the time, baby A comes out, they wait, and then guess what? You're pushing 5 minutes later, 10 minutes later, up to maybe 30. I don't actually have numbers on that, but from my experience, we're talking like you have baby A and within 30 minutes, twin B is born, okay? So it typically is fast, but I've had 10 hours between twins. I remember one that was 5 hours. I was actually a birth coach for her. And so flex and flow on that one, but we want to make sure we're in the OR because in 4 to 10% of twin A vaginal births, twin B actually has to be a C-section. You're like, what? And this is where sometimes a lot of moms may opt for a scheduled C-section because they don't want to take that risk of having a vaginal birth and a C-section all in the same day. All right. And so that's the risk that you take. Now we're talking 4 to 10%. So it's still low, but the risk is that there's something called an umbilical cord prolapse. I'll talk about this more in part 3. But when baby A comes out, there's now space. And if the umbilical cord slips out, we're in an emergency C-section. Okay, that is an emergency. There's no going back. There's no delivering vaginally. We got to do a C-section. Okay, and that is a risk with twins delivering vaginally. Or you can't get twin B out, or there's fetal distress, or fill in the blank, but baby B needs a C-section, okay? And that's a bummer. That's why you're in the OR, and that is one of the reasons why I'm gonna suggest that you actually consider having an epidural, that you don't have sensation. They can dose you up for a C-section in that moment, and then you're still awake for your C-section for baby B versus general anesthesia, which puts you to sleep, okay? So you're in the operating room. Hopefully within about 30 minutes, you push, baby comes out, and you can do skin to skin with both. You can breastfeed both. You can still have that time. Most of the time, they're staying with you, obviously flex and flow based on prematurity or other complications. And then after that, you would be moved back to a recovery room where then you get to snuggle your babies, you get to breastfeed, or you start your pumping journeys and they get you to the NICU as soon as possible. I hope that helped all of you twin mamas. Really, the takeaway is that all of the information that I teach about what is labor, when to go to the hospital, all of that, you're taking that information to your provider and saying, okay, so I know about normal labor with one baby, normal, okay, and then what variations would you make for me in my pregnancy related to twins? What do I need to know? And they're gonna be able to specify based on the facility that you're delivering at, based on their preference, their experience, and you'll be able to come up with a plan. The thing is too, you still have a lot of control, okay? especially for the labor portion. All of the labor hormones, the relaxation, the coping, all of that still applies for a twin pregnancy. You're just not gonna make it to 40 weeks. Expect to be ready a little bit earlier. And then on the mono side, those ones are going to be a scheduled C-section. You may actually be hospitalized for weeks leading up to your birth. And I'm going to talk about that in part 3, where I talk about why twins are a high-risk pregnancy, especially comparing types of twins, the mono, di, mono, di, twins, for their risk related to pregnancy, and what are the things you need to be paying attention to, and how do you set yourself up given that you're considered a high-risk pregnancy for a positive experience in the meantime. If you have any questions, feel free to throw them in the comment box down below, and I may answer them in a future Coffee and Questions. Make sure you follow me on Instagram. Lots more going on over there, and then you can check out the infographic I have on types of twins for you to visualize what that looks like. Make sure you subscribe down below. Feel free to share this with your twin mamas, with your pregnant friends, and then until next time, don't forget to flex and flow, double flow, and I will see you next time. Bye.